Electrophysiology is a highly specialized type of cardiology which focuses on diagnosis and correction of the pacing of the heart, its electrical impulses, and arrhythmias. We went to Valley Presbyterian Hospital in the San Fernando Valley and spoke to Dr. Polosajian, a cardiac rhythm specialist, and asked him about his specialty, electrophysiology.
Electrophysiology specifically is to study the electrical system of the heart. So for instance, when someone passes out, or for example, when someone has an extremely rapid heart rate, or palpitations, shortness of breath because of palpitations per se, or dizziness, lightheadedness, syncope is passing out, then we basically need to look into the electrical system.
Dr. Polosajian talks about atrial fibrillation, or AFib.
AFib is the most common arrhythmia. AFib is when the upper chamber of the heart starts to fibrillate. It starts to quiver. And one risk factor of that is you can get a stroke in the event that you're in AFib for longer than 48 hours, constantly. Sometimes AFib can present itself as paroxysmal. It comes and goes. Then it may be persistent, then it may be chronic. This is the pulmonary artery. This goes towards the lung, this vessel. This vessel is connected to the right side of the heart, the pulmonary, because it takes deoxygenated blood, brings it to the lungs in order for the blood to get oxygenated. Then from there it turns from the lungs and comes to the pulmonary veins. From the pulmonary veins it enters into the left atrium. From the left atrium into the left ventricle, from the left ventricle into the aorta, and the aorta to the body. So the reason this pulmonary vein business is important is because when you have atrial fibrillation, and especially if it's paroxysmal or persistent, many times, majority of the time, it starts from the pulmonary veins, and the electricity starts from there and it shoots into the left atrium, from the left atrium into the right atrium, and arrhythmia continues. AFib, in the past we could not cure AFib. We didn't know how to cure AFib. Then surgical procedures came about where they did a basically maze procedure. They actually had to do an open heart surgery and take the left atrium, cut it in pieces, resuture it together, kind of like make a maze out of this. And when they did that, they discovered that the electrical system could not fibrillate any longer, and sinus rhythm, which is a normal rhythm, took over. Nowadays, what we do is we do ablations, same technique in a way, but without open heart surgery. The procedure is done as an outpatient. Patient comes in, gets it done in approximately 3 hours, and stays one night overnight for observation, goes home the next day. Recovery is so fast, they go back to work in 3 days or 2 days. This is a pacemaker. As you can see, it's very small. Pacemakers are implanted to prevent slow heart rates, not rhythm, rates. So when the heart rate goes down, for example, less than 60 beats per minute, and the pacemaker is set at 60, the pacemaker is a demand pacemaker, will kick in order to restart the heart per se electrically, to pace the heart.
The doctor tells us what he sees for the future in treating heart arrhythmias.
I believe that ablation will stay because it's helping a lot of people fairly quickly, outpatient procedure. I believe medications may grow in regards to specifically for arrhythmias, but if you catch the arrhythmia early on, you can definitely help that patient and prevent many other symptoms from coming.